I'm fine, and you?
I'm very well. Okay, and my name as always is Mary Omeni Wode. You can call me the Slim Diva, your most adorable DJ J Boy is on the deck this morning.
Yes.
And yes, together we'll make this time from now till 12 noon worth a while. But before we go ahead to introduce guests, we'll be having guests who will be joining us this morning. I mean, you need to see the squad, that we'll be having in the studio today. Fear me, fear Echo FM, fear these people. But I wouldn't let the cat out of the bag yet. But let's go do some update before we let the guests in on what we'll be talking about for today. And to start off, the very first update I have here says that child health experts have said that cough is not a sign of teething, dismissing the long-held claims among many Nigerians that link the emergence of teeth to respiratory symptoms in babies. They explain that while teething is a natural and normal developmental process, it does not cause cough, warning that such assumptions may delay proper diagnosis and treatment of underlying illnesses. The experts and pediatricians stress that a persistent cough in infants is often a symptom of viral or bacterial infection, and in some cases, more serious conditions that require medical attention. Don, you will agree with me that when a baby is teething.
But to be honest, I'm just hearing it for the
You're
first
just
time.
hearing it, okay?
Yeah.
Some people usually link cough, catarrh to teething, and when a baby is teething,
But
and
there's no link with it anyway.
yes, that's the thing. Lots and lots of what do they call it now? False information and fake news when it comes to some issues. And some African mothers will tell you, once they suspect any slight cough, he's teething.
Yeah.
That's why he's coughing, without knowing that maybe that child has got some respiratory, issues.
Yeah.
Okay, and then the second one says that as part of key strategies to curb the rising burden of obesity in the country, health experts have called on the federal government to integrate obesity prevention services into the primary health care centers nationwide. And then they went on to note that the primary health care centers remain the first point of contact for many Nigerians and provide a strategic platform for early screening, nutrition, counseling, and lifestyle education needed to prevent obesity and related non-communicable diseases. Already we know that obesity has been linked to a lot of illnesses, and that's why it's good to start to curb it as fast as we can from the primary healthcare centers. They want this information to get to them first before disseminating it to the hospitals in the urban areas. And I think it's a good move. If experts are able to do this, I believe that more people in the rural areas will be aware of obesity and the causes, and try as much as possible to watch what their children eat, because I know that diet plays a very huge role. Okay, and then the last update before we introduce our guest this morning. And we got the sad information all the way from Enugu State, from the Association of Psychiatrists in Nigeria, condemning the murder of a consultant psychiatrist at the Federal Neuropsychiatric Hospital, Enugu, by name Dr. Andrew Orovigo. And then they've actually come out to demand justice and compensation for his family. I don't want to go deep into that, but from what I can see, he went, to visit a family member, and then got a call from a sick person calling him to, come over to their house to come check the person and all that. And you know what doctors do?
He hurriedly went.
Thank you. Their aim is to save lives, thinking it was actually true. He rushed out from, that place that he was on his way to that particular spot that he told him to get to. He was kidnapped, and then I think they beat him up and did a lot of things, and then dumped him at a site. He managed to stay alive till the following day. His body was found actually at an evacuation site where they load sand, and then they rushed him to the hospital. He spent like 2 days in the hospital, but actually didn't survive. So it's a sad one. We always complain of brain drain that our doctors are leaving, and the information we are getting is that this particular doctor actually didn't want to leave. He had the opportunity to fly out of Nigeria, but he said no, that he had a lot to offer Nigeria, and then he stayed back. Unfortunately, see what has happened to him. Well, it's a sad one. And we actually extend our condolences to psychiatrists in Nigeria, and we pray that this doesn't happen again. Okay, shall we go over to the topic for today, and let's make welcome our guests in the studio this morning. They're actually supposed to be 3, but I'm seeing 2 persons. I actually don't know why, because I already hyped the squad. I already hyped the team. Dr. Ibekwe Nnemeka is here this morning. Good morning to you, Dr. Ibekwe.
Good morning, Slim Diva. Good morning, Molites.
You're welcome.
Morning.
How have you been?
I'm good. And you?
Very well, thank you. Okay, Dr. Ibekwe Nnemeka is a consultant, ear, nose, and throat, head and neck surgeon. He's also the head of Department ENT, HN Federal Teaching Hospital, Owerri, and also the Secretary, Nigerian Medical Association, Imo State Branch. Also in the studio with him, we have Dr. Nwankwo Darlington Chigozirim. Good morning to you, Dr. Nwankwo.
Good morning, and good morning to our listeners.
We've not seen this year. We've not spoken this year. So happy New Year. Happy Valentine.
Happy New Month.
Happy New Month. Dr. Nwankwo, you're welcome.
Thank you very
Dr.
much.
Nwankwo is also a consultant and ENT head and neck surgeon. You are welcome. Actually, cannot find Dr. Nkwocha, but I was expecting him to be here. But all the same, we will move on. Okay, so today, world over, March 3. It's been observed as the World Hearing Day, a day set aside to raise awareness about hearing loss and promote ear care globally. And then when we did this research, we actually noticed that over 1.5 billion people globally experience some form of hearing impairment, with the numbers expected to rise. 1.5 billion globally. Do you know what that means? So it's very, very important we go ahead with this awareness and join the rest of the world to tell them what to avoid so that they don't come down with hearing loss or hearing impairment. Okay, Dr. Ibekwe, I'll start with you this morning.
Okay.
You're welcome once again.
Thank you.
So help us, general overview of what the Hearing Loss Day aims to achieve, and then we slide into the theme for this year. Then we go ahead.
All right. Thank you very much once again, Slim Diva. Thank you, Imolites. Once again, we're here celebrating World Hearing Day of 2026. We are from Federal Teaching Hospital, Owerri, Ear, Nose, and Throat Department. So we are here to enlighten the populace on the impact of hearing, also emphasizing that every child deserves to hear better. And like you said, this year's theme talks about from community to classroom, hearing care for every child. Okay? So, and is all aimed at preventing avoidable children hearing losses, and also emphasizes on early detection or identification of a hearing problem the child has, and also correcting it. You know, because by the time if you detect it early and take care of it early, it goes a long way in helping that child to develop both in speech and also in learning in school. So that's why we are here to educate. We chose that team, the community and the classroom, because those two places are the main entry points where you can actually screen the children of hearing loss. In communities, once the child is born, within first 28 days or a month, the child should have a hearing screening done. That's how it's done over, in abroad. Okay. Yes. Then also in school, as you're enrolling the kids to school, every child being enrolled to school should have a hearing assessment done. You may be imagining some children may not be performing well in school.
Yeah.
You think that they are hearing what they are teaching. They are not. They are not. So that's why we're here to enlighten the public on the relevance of, preventing some, preventable hearing loss causes, and also identify the possible causes of a hearing loss and to take care of it early.
So the aim is to catch them young.
Young, yeah.
And you said something that struck me. The first 28 days, after a child is born, right?
Yeah.
Yes.
There should be a form of hearing assessment.
Assessment, yes.
In Nigeria, I have not seen anything like that. Have you? When a child is
outside the
born,
country.
Yes.
we're in
It's
Nigeria.
obtainable. It's obtainable.
Outside,
Yes,
not here
outside,
now.
yes.
Because
Yeah.
after a woman gives birth, the
Yeah.
next thing is
It's to carry
omugwo.
it.
They carry the child home. Nobody checks the teeth.
Yeah.
Nobody
At
checks the
all.
ear.
At
I
all.
feel, this is a good one.
Yes.
Yeah.
If we are able to incorporate this in our healthcare system,
Yes.
I know that the issue of hearing loss or hearing impairment will be detected early enough.
enough.
But how early is early, Dr. Ibekwe?
Yes, how early is early? Like I said, immediately the child is born, we have a device that can screen the child's hearing. Yes, we have a device called the auto acoustic emission device, OAE. It's used to screen the neonates. Neonates are those within first 28 days. That's why I said 28 days.
Okay.
So any child that is born, within the first 1 month should have hearing screening done. In fact, some countries have it as a law that you don't miss it out. So if our own country can, legitimize it, put it as a law, and also provide the equipment or the apparatuses to do that. Even those in the primary healthcare and all should have, that device to screen every child that is born. It's very important.
That's a good one. Just like we have the compulsory immunization
Very
for
well,
newborn
very
babies.
well.
I think this can also go in as a routine check.
Yes.
Yeah. Okay, Dr. Darlington, let's go over to you. Hearing loss. In as much as the world is observing the Hearing Loss Day, most people might not fully understand what it means when you say someone has hearing impairment.
Yeah.
So just do a general overview. Let's really understand what hearing loss is, and then we go over to other parts of the discussion.
Thank you very much. As you rightly said earlier on, up to 1.5 billion people has been projected to have some level of hearing loss or the other. And even this projection is even going higher by the year 2050. We are projecting that up to 2.5 billion will join this 1.5 billion that is already in existence.
Wow.
And but the good news is preventable.
Okay.
And that is why we are taking this program, the World Hearing Day, very serious to make sure that we prevent that projection by 2050.
Okay.
Yeah. So whenever an individual have signs of always asking you to repeat yourself, whenever you have that sign of always straining or bringing one of your ears closer to hear what somebody is saying, whenever you feel that you are calling your child repeatedly and that child takes some time to respond to you, you have to raise your voice before that child responds to you.
Yeah.
Whenever you see your child that is hale and hearty performing very poor in school, these are subtle signs that this child is not hearing very well.
Okay.
And these are subtle signs that even an adult is not hearing very well. And whenever you notice these signs, it is good for you to take such an individual to hearing screening. And hearing screening, we measure hearing loss based on decibels.
Okay.
There are a level of decibels that we will see that this child or this person is losing in hearing, that will now say, oh, this person is having hearing loss. And most of the hearing losses can be corrected. Most of the hearing losses can be corrected. So,
But I believe that there are stages, right?
yes,
There should
there
be
are stages.
Okay.
There are
Okay.
stages. That's why we have to be proactive so that most of the hearing losses don't get to severe to profound type.
Okay.
Yes.
Okay. So in being proactive, that's where maybe management and treatment comes in.
Exactly.
But I want to ask, you said by 2050 there could be a surge in
Yeah.
numbers
Yeah.
from 1.5 billion to almost 2.5. That's much.
Yeah.
So, but why do you think there's an increase, or there's going to be an increase? Is it in the way we live our lives? What could be the problem?
Yes, it's actually in the way we live our lives. If you look out now, there are increase in the number of industries around.
Okay.
So that increases the number of sound or noise that we are exposed to in our daily activities.
Wow.
And chronic exposure to sound have effects, a negative effect on our hearing. So that is one thing, industrialization.
Okay.
That secondly is the fact that everybody has access to over-the-counter medication.
Medications.
Somebody is sick, he walks into the pharmacy, takes any prescription without adequate dosage and all that. Most of these drugs are autotoxic. Autotoxic means that they have negative effects in the ears, especially when taken in an inappropriate dose. So these behaviors will further increase the number of people projected to have hearing loss in future.
I relate with what you just said. Sometime last year, I shared a story of someone who took overdose of anti-malaria medication. She was supposed to take, and I don't know if Dr. Ibekwe will remember that particular story. She was supposed to take the normal, I think it was 2 in the morning, 2 in the night, and then she took the whole pack. And then, hey God, small thing, just small thing.
Yeah.
That day, she all of a sudden, it seemed more like she couldn't hear anything. And we started running helter-skelter, only for us to find out that it was as a result of the overdose of the medications that she took. So I relate with what Dr. Darlington has said. But Dr. Ibekwe,
Yes.
to come back to what Dr. Darlington said, he made mention of increase in industries. Nobody is talking about I better pass my neighbor.
Yeah.
Increase in generator,
Yeah.
sound, every
These days-
night, every morning.
These days that NEPA don't give us light again. You know, there will be increase in noise-induced hearing loss. Those using pass my neighbor and generator. In fact, I don't know. I just pray that God will help us in Nigeria. Because last time I traveled to Accra, Ghana here, I didn't hear any sound of generator.
Are you for real?
I'm telling you the
That's
gospel
not so
truth.
So they have,
They have
power supply.
Power
24
supply,
hours.
yeah, 24 hours. They say before they take light, they have to inform the citizens before Ghana here. So if you are doing a business of generator there, you won't make any
won't
profit.
make it.
Yes, you won't make any profit.
They'll have to inform their citizens.
Citizens,
If
yes.
this one, no information,
No
nothing.
information.
Before you blink
they
your
won't
eye.
even give you light, and they will bring
That's nice.
NEPA bill for you to pay.
Before you blink, before you open your eye and close it, the light is gone.
It's
and you're
gone.
wondering
It's very
what's
unfortunate.
going
So
on.
that causes a lot of noise-induced hearing loss. You may not notice it
Yeah.
immediately. That's what we call temporary
Threshold.
threshold shift
Okay.
and permanent threshold shift.
Okay.
Temporary, it may just be there. You won't be hearing as much as you used to. After it will rectify, you will still be normal.
Okay.
But if you are sustained on that intensity of noise for a long period of time, you will now graduate from temporary
to
threshold
permanent.
shift to permanent threshold shift, and that one is irreversible.
Wow.
When it gets to the permanent threshold
yes.
shift.
Yes.
Wow. Okay, now, before we go ahead, there's a disturbing trend, Dr. Ibekwe. I don't know
Yeah.
if you've noticed, especially the young guys that we have, is a trend. You see them going around with MP3. And they increase the volume. They usually do not mind if people are even around them. But I don't know, I'm trying to make a point. Now, we have a growing trend of young guys who feel that if there is no noise, if the music is not high enough, they enter the head. Is that also a problem to the ear?
Yes, it's a very big problem. There's just like what I said about temporary and permanent threshold shift. As long as they are being exposed to that loud sound, there's a permissible frequency of sound that we're not supposed to be exposed per day. So if one is exposed to that increased number of frequency of the loud sound, in a day, of course, the person will have that temporary threshold shift. Then over time, it will lead to permanent threshold shift. And you will see the symptoms. The person may come to the clinic to tell you that I'm having sound, like buzzing sound in my ear. Ooh, is a telltale sign of hearing loss that is about to, yes. So when you have such a complaint, every time you're hearing what we call it tinnitus, buzzing sound in the ear. Okay, so and from time as time graduates, the person also start complaining to you that he cannot hear very well again. By the time you ask about are you exposed to any kind of loud sound, you will not remember. I usually use this headset all the time, and then if you ask, do you regulate the volume or you increase it? Sometimes they increase it, just like you said, to enjoy themselves, not knowing that they're killing themselves. So we are using this medium to advise our younger ones, the youths. Please, we said it's better you use a headset than this what they call it, earpiece.
What of earpods? Is it AirPods? What do they call it? AirPods or earpods? I don't know what it's called. The one they put in the ear.
Yes, earpod. Anything that transmits sound directly into the canal causes more damage than the headset. That's okay. That one is wide. The sound is sparsely, distributed. So we advise that they use headset and reduce the volume. The most important thing is to reduce the volume, okay? Because if you don't, you may rupture the tympanic membrane, that's the eardrum. There are some bones, tiny bones within the middle ear called the ossicles. They could also disrupt them, okay? There will be ossicular discontinuity and all those things, and even the state. So all those things can be, disturbed. And once that is done, the person will come down with a hearing loss.
Wow.
Yes.
So just these common things that people feel are actually common.
Yes.
Lifestyle
Yes.
choices, the use of earpiece, the use of AirPods can actually predispose your hearing and, to coming down with, what is it called? Hearing impairment.
Hearing impairment, yeah.
Exactly. All right, I think it's time to open up the phone lines and let's try to squeeze in one or two calls before we go back to the conversation.
Okay, and the phone line to call is 0911 20022 0707 454 1014. 0911 20022 0707 454 1014.
Alternatively, send us a WhatsApp message on 0707 491 3438. And you can also go to Facebook, drop your messages. We are live on Facebook at Echo FM 100.7. Not just Facebook, YouTube as well.
Hello. Hello, good morning.
Good morning. I greet everybody there in the studio.
Okay.
Mary.
Yes. Good morning. What's
Hey,
your
how are
name?
you?
Very well, thank you.
Every time you don't know my voice again. This is my key.
Mikey, don't crucify me, please. We have a lot of callers. Please, I beg you. You're welcome.
How you doing?
Ade the way una keep me.
Okay. Your voice is standing inside. I can't hear you clear.
Ah, really? Okay, just go ahead. We can hear you. Go ahead.
So as I said, this is my key calling from Apapa.
Okay, you're welcome.
So I just want to to commend you people there what you are doing. You're doing a nice work.
Thank
So
you.
that's I just want to say you people should keep on doing a good work.
Okay.
ECHO is number one in Imo State.
Thank you.
That is what my key says.
All right.
I believe the people there. So you people is trying. Thank
Okay.
you. God bless you people.
Thank
Thank you very much.
Thank you, Engineer Mike E, for your commendations.
Hello, good morning.
Hello, good morning. Who are we speaking with?
This is Awuja calling from Mekede.
Okay, Abuja, you're welcome.
You see, I think I enjoyed this program now because there is a chap I brought from the village to stay with us here in Mekede. Then after Christmas, the girl will even be here. You call her, she will be looking at you.
Are you
Then
for real?
when I check,
I said, are you for real?
what?
Go ahead.
Okay. So when you call her, she will be mopping at you, very close to you. She won't fear. Then, if you check her exercise books, and she goes to school, nothing, 0, 0, 0, 0.
Oh.
I asked, what are you doing? Then I went to the school and asked her, the girl, it appears that she doesn't hear what they are teaching in the class. So with this now, I think I will have to take her to clinic.
Yes.
For her.
ENT clinic.
Though I went home and asked the parents, does she hear at all? They said that she pretends that she doesn't hear. That this is about pretense. Because of this now, we see what I do to get her okay. I think she has having ear problem.
Thank you. Thank you so much, Auja. Dr. Ibekwe, you want to respond?
Yes, okay. Thank you, Auja, for that. You know, a lot of people may think that their words is malingering or pretending not to hear. Yes, not knowing that they actually have hearing impairment. Okay, so I want to encourage you. You can bring that chap to Federal Teaching Hospital Owerri.
Or any hospital?
Or any hospital, but it has to be an ENT that will manage, her. That child needs a thorough hearing evaluation for us to know how much she can hear and the type of hearing loss she has and how we can be of help to her. It's not yet late, I believe. It's not yet late. But such a child is supposed to be in special school, not in a public school.
Public school.
Yes.
Okay, thank you very much for that. Hello, good morning.
Good morning, Mary.
You're
Good
welcome.
morning.
Hey, Don, good morning.
Good morning. What's your name?
Samuel, calling from Nazareth.
Okay, Samuel, you're welcome.
I greet the doctors in the house.
Good morning.
Thank you.
I appreciate your teaching. It's so useful to us. Please, doctor, I want to ask, what about this use of cotton board in the children's ear?
Okay.
Does it have any ugly effect?
Okay.
Okay.
Thank you. Thank you, Samuel. Dr. Ibekwe, you respond, but let me take this one. Hello.
Hello. Morning, Mary from Manyweather.
Good morning.
morning to you. Welcome.
Thank you. Happy New Year to you.
I wish you the same. You're welcome. Go ahead, please. What's your name?
Okay. I am Elder Matthew Okoro.
Oh, Elder, it's good to hear your voice this morning. How have you been?
Oh, thank God for I told you it has been a long time. I came to Echo the day you had your 1 year anniversary.
Last year, December. Go ahead, Elder. You're welcome, okay?
Okay, thank you so much. I thank the doctors there because they are clearing issues for us. And they referred to this first call. First call should be this our hospital that is within us in the rural areas. And when you get to such health centers, as we call them here, you don't get adequate treatment as of that of the hospital, where you get, trained doctors.
Okay.
Why I'm saying this because when you go to this ones in the village, they will not tell you this medicine is not here. We will refer you to so place, or you go and buy this. Why must government not give these people enough medicine so that when you store enough drugs, when patients come, they will be treated?
Okay.
Thank you.
All right. Thank you, Elder. Dr. Darlington, use of cotton buds in children. He was specific. He said children, but I think it also applies to adults. Does it have any effect on our hearing?
Please, I'm using this medium to warn everybody, both children and adults, to desist from the use of cotton buds in the ears. In fact, it's boldly written as an instruction on the cotton bud pack that you should not insert into your ears.
Okay.
Now, there are so many reasons why you shouldn't do that.
Okay.
Number one is that cotton bud can traumatize the eardrum, or it can traumatize the walls, the canals, the wall of the canal, of the external auditory canal. That cotton bud can also introduce infection into those ears. So most times we've seen cases where after using cotton bud, days after using cotton bud, people come down with severe ear pain, ear discharge, and all that. Because those cotton buds, they are not sterile. So you can actually carry things and introduce into your ears. And again, one of the reasons why people are making use of that cotton bud is to remove wax or dirt in the ear. But it may surprise you that 90% of the wax that you're trying to remove, you end up piling them up inside the ear. Wow. The cotton bud might just stain, and you are happy that you are cleaning out something, not knowing that the majority of the debris or the wax or the dirt that you're trying to bring out is still packed inside the ear. And again, the ear has its own cleaning mechanism. It sweeps out dirt just the same way the eye and the nose sweep out the dirt introduced into them. It's only when you are seeing these dirt outside the canal that you can use the cotton ball to bring them out, but not inserting them or dipping them inside your ear canal.
So you mean, let's just simplify it, because for the benefit of everybody's hearing ear canal. Are you talking of the hole
inside? Don't put the cotton ball inside that hole, inside that ear hole.
But the one
you can use it.
If you see the wax or the dirt, you can clean with cotton bud, but not outside. The ones you cannot see. You don't go pursuing it. Yes. Because if you pursue it, it will push it, and it goes and plaster on the eardrum.
Okay.
So most people will tell you, after using the cotton bud, they now experience that their ears are blocked.
They can't hear better.
Yes. They'll not start running helter-skelter looking for hospitals.
What a bed feather.
That's actually the worst.
Yeah, cover of pen.
That's actually the worst.
Even toothpicks. Some people use toothpicks. They'll come down with outer ear infection.
Yes.
We call it furonculosis and all those stuff.
Hello.
The feather, people come down with fungal ear infection mostly with the feather. So because these things carry all these microorganisms without you knowing.
Yeah.
So using the cotton bud is a no-no.
No.
Please.
Okay.
I know the feeling that Slim Diva used to have while using feather.
That feeling is out of this world. You've not talked about grass. Some people, God, though, that feeling. You close your eye and you are in another realm. Okay.
So if you are having a persistent itching in the ear, that doesn't go away.
Yes.
If you're having ear blockage or whatever, kindly reach out to any ENT clinic around you.
Okay.
It might be an infection which needs to be treated, and the patient will be fine.
They should desist from self-medication.
Self-medication. Okay. Another important question before we go back to the phone line. What if someone has a tumor or a growth, maybe on the head or somewhere? Does it also impact the hearing somehow? Can it?
Yes.
That was the question I wanted to ask.
If you have tumor in the ear, if it's in the outer ear or the middle ear, of course it causes what we call conductive hearing loss, because sound wave will not be able to be conducted. If, for example, if it's a tumor in the outer ear, there will be an obstruction of a sound wave going to hit on the eardrum, which will transmit it through the bones within the middle ear to the inner ear. So because of that tumor, there is this conductive hearing loss, caused by the growth of the tumor. Okay, so if the tumor is within the middle ear, the same conductive kind of hearing loss will also be noticed or seen. Okay. Yes.
Even tumors in the nose and the back of the nose
can affect.
So what if there's no tumor? What if it's just head injury? How does it affect the ear?
Yes, head injury. If you have a head injury that, like those that have, let's say, road traffic accident or any kind of head injury that affects the temporal bone mainly, because that's where the hearing center is.
Seated.
Yeah, seated there, the temporal bone. If it cross, also if it affects the hearing center, of course, the person will come down with hearing loss. Okay, then there are some other head injury that will not affect hearing. So it depends on where it cuts across. Yes.
Okay. And then are there underlying diseases or ailments that can predispose people to, coming down with hearing impairment?
Sure. Sure. Those people that have any form of immunodepressive states, those that have, let's say, human immunodeficiency virus. Yes, those on that has
Chemotherapy.
kidney diseases, that is on drugs. You know, those on chemotherapy, they have any kind of cancer. They are receiving drugs. Those drugs are ototoxic, like he said. It kills the cochlear hair cells, and because the hair cells are what helps to conduct sound. So most of those drugs kill some of those hair cells. So even diabetes, hypertension, even hypothyroid, those that have a thyroid gland. Yes, all those things are background diseases that can predispose, one to have a hearing impairment.
Wow, this is getting more and more interesting. I was maybe later towards the end of the program, we'll still have to reel out some of those occupations that people are into that can predispose them to coming down with hearing impairment.
Very important.
All right, Goswill from Police Barracks on WhatsApp says, good morning, Mary and the doctors and Dawn in the studio. The doctor has already answered the question that has been on my mind for a long time on the use of AirPods and headphones. Thank you very much for your message. Keep your calls coming in 0911 20022 0707 454 1014. Send us a WhatsApp message, and Dr. Ibekwe and Dr. Darlington will be here to respond.
Hello.
Hello. Good morning.
Good morning.
Yeah, my name is Samson from Alabama.
Okay, you're welcome.
Yeah. I want to ask, can airport that you always use airport to answer calls all the time? And sometimes I will feel like my head is empty. I just, it's turning me around. I feel like I want to fall.
See deliverance.
So, I don't know if it's that airport that is causing those problems.
Okay, nice one.
I'm surprised that if I didn't increase the volume of the airport, those ones that have big sound, I can't enjoy that sound.
Oh, that's why it's turning you around. Dr. Ibekwe, or Dr. any of you can respond, please.
So, it's important for us to note that our ears are not only for hearing, they are also organs responsible for our balance. So when the young man is saying he's turning him around, it's obvious that the inner ear has been affected by the chronic exposure to this loud sound.
Okay.
In fact, as a rule, we call it rule of 60. Any AirPod, headphone, or whatever you are using, you must make sure that you are not turning up the volume of that device they are using up to 60% of the total volume of that device, and you're not using it for up to 60 minutes. So that's why we call it rule of 60.
Oh,
The moment you do this, the moment you turn up the volume of that device for more than 60%, and you're using it for more than 60 minutes,
that's 1 hour.
You are now endangering that ear to
a lot of issues,
hearing loss, and a lot of issues.
60 minutes in this country, where you have someone that will put it in the ear for a whole day.
So that tells you that many people are already exposed to chronic noise, and this young man should actually stop. And again, this young man should have a hearing screening as soon as possible. Because if he's still in the temporary threshold shifts, as Dr. Ibekwe said, there are things that we can do to correct it and revert it.
Okay. All right, on WhatsApp, good morning to you, the Slim Diva and Dawn, and our doctors in the building. My question is not related to today's topic, but I have a female friend that has a growth, goiter, on her neck. It's been there for more than 3 years. She doesn't experience any form of pain there, but please, what can I do about it? Well, Benjamin from Okigwe Road, go to the hospital. It's as simple as ABC. Thank you very much. Good morning, Mary, Dawn, and our guests in the studio. I am Pastor Samuel Okolie from Njemanze Street. Please, a boy of 14 to 15 years that is having hearing problem, can there be a solution to it, or has it passed the stage of being treated? Okay, he said healed, but let's use the word treated.
Treated,
Thank you, and have a nice working day. Dr. Ibekwe.
Yes, of course, there's no age limit to treating hearing impairment. So even if you are 90 years or 80 years, as far as is something that can be reversed.
Okay.
Yes. So the thing is that you need to see an ENT surgeon to get that ear evaluated. Like I said, we have the devices that can help, assess the level of hearing loss the person has. Okay, we have devices that can check on that, and then if it's something that the person will need the device that will help him or her hear better, we can recommend that. We have what we call hearing aids. Okay, like I usually tell people that as I'm wearing my glasses, this is my visual aid. You also have a hearing aid. If it's something that drugs cannot help, person can be recommended a hearing aid. There are ones that you may not even see inside the ear. We call it in the ear or in the canal. Okay, there are some that looks like Bluetooth. So the main thing is that the boy needs to see an ENT surgeon immediately to get his ear evaluated and for us to know how we can, be of help.
Okay, let's take this call. All right.
Hello. Good morning.
Hello, good morning.
Good morning. Who are we speaking with?
I'm Justice, your name. I'm calling from Irete.
Oh, Justice, you're welcome.
Thank you very much. Actually, I really want to commend the Echo FM for all these things that you are doing for us, because we are the beneficiaries. So God would bless you people for that.
And bless you
and
too.
Bless you and bless our doctors as well. Yeah. Go ahead.
Yes. And also for bringing professionals. All the people you people bring in your studios, they are professionals. They are wonderful people.
Thank
the
you.
Explanations and everything. In fact, I don't usually mix this program coming up at this time. I don't usually miss because I know and I have a lot to learn. I've learned from them now. As they are talking, I remember my experience back in the days when I usually go. I don't go without my earpiece. At a point, the thing mistakenly fell into my ear, but I didn't even know. The thing was inside my ear for some years. I didn't even know that I was carrying something in my ear, and the thing became a very big problem to me, even to the point of trying to block my ear that I cannot hear. But it was just a miracle. What I'm telling you is experience. It was just a miracle.
Wow.
On that fateful day, I cannot forget. On that fateful day, just locally, I don't know, the thing just pulled away from my ear and fell on the ground. I look at it. It was a pack of earbuds. It was terrible. Wow. So I commend you people, and I commend the people that you are bringing the studio. God will continue strengthening and bless you people.
Amen.
Thank you all.
Thank
you.
you. Justice
Thank you
from
very much.
Irete. All right. Message.
Okay, good morning, Echo FM. My daddy is finding it difficult to hear when we talk, except we shout so much. He is a diabetic. No, he is diabetic.
Can that be the
cause? If yes, what do we do? Anonymous.
Okay. Any of you can respond.
Okay, well, I think we've said it here before that one of the predisposing element is diabetes.
Yeah.
Okay, so diabetes may be a cause for your dad's hearing impairment. Also, there's also what we call age-induced hearing loss. That is presbycusis. Okay. So it's also a possibility that he also has presbycusis, alongside with diabetes. Okay, so that all those things will be
double risk factors.
Yeah, double risk factors. Wow. So the advice still remains: go and see an ENT surgeon for us to know how we can assist your dad.
Okay. I relate to what he's saying. Growing up, I had a granddad who you would shout, you would scream at the top of your voice before he would even hear. So I believe it comes with age too, right?
Yeah, yeah. Some people, their own this thing comes as young as 45 years.
Wow.
Yes, some people have presbycusis as early as 45.
Wow.
Why somebody may be like 80, he's still hearing very well.
It's true.
So it depends on your genetic makeup. Everybody's wired differently. Okay, so we advise from age 45, have a way of periodic, regular hearing check. Okay. More especially those who are exposed to loud sound, loud
sound.
Yes.
Okay, so how frequent would you recommend that they go for these checks?
For those that are predisposed to where there's noise, at least annual checkup is very important.
Okay. The other day, that brings to mind something very important that people haven't looked at, Dr. Ibekwe and Dr.
Yes.
Darlington. The other day, we talked about grinding machines in the market.
Yeah.
There are people, and most of these people who sit around these grinding machines are usually the elderly ones. Day in, day out. Year in, year out. Every day, that sound, will it have any
no
impact?
form of protection.
No form of protection. So, will it also have any impact on them?
Yes, it will have a great impact on them, very big impact on them. In fact, most of them, if you ask them, they will admit to you that they are having one symptom or the other. Most times, they will tell you that they are having a ringing in their ears.
Like the buzzing.
Yes, that the buzzing sound in your ears. So, those that are chronically exposed to loud sound like that, grinding machine, those that work in bottling companies that are using heavy-duty machines,
granite,
quarry
industries,
people that work in the club at night. Every night you'll be exposed to that very loud sound. So these are categories of people that are at risk of noise-induced hearing loss. And these people that should have at least yearly screening, hearing screening done for them. But again, there's something we call earplugs. Earplugs are meant for this category of people. Because you will not say because of the grinding machine that an old woman should leave her business.
Okay.
So it is better for them to get earplugs,
protective device.
use them while they are at work.
Earplug, how does it look like? Is it like a headset or?
Yes, some come in the form of headsets. Some come in the form of earpiece.
Okay.
So all you have to do is use it, plug your ears. You'll still be hearing, but it will reduce the decibel of sound that your ear does not need.
Cause acoustic trauma.
Yes.
Okay, all right. We are trying to round off right now. Dr. Ibekwe, before I also get the parting words from Dr. Darlington, is there anything we have not touched on? And then parting words as well.
Okay, this is a general for all of us. My own parting word is that the childhood hearing loss is preventable. Especially the women that are pregnant, we advise them to always go for the antenatal. It's very important. Go for your antenatal. Deliver in a very good hospital. Some of them go to maternity and all those, some places that are not approved, and the child will come down with a form of a hearing impairment. Also, avoid taking any kind of substances when you are pregnant, okay, because it affects the child hearing. Okay, then also make sure your child receives some vaccination, because there are some hearing impairments that vaccines can prevent, like the measles, rubella, mumps, all those stuff have their vaccines that can be, if the child received it then. Don't always tell your child to avoid whenever they come to school any injection or whatever. No. Some of those things helps to prevent some of these untoward effects. And if the child cannot hear well, he will not develop speech well, and it affects their cognitive functions.
Yeah.
So it also goes a long way affecting them in the future. There's this social separation from the crowd, and it goes a long way also impacting negatively economically to the parent, because it's very expensive to take care of a child who cannot hear or who cannot speak. So I want to advise that we should also be very attentive to your child. Anytime you notice that your child is always, whenever he wants to watch television, he increases the volume or he gets close to something is wrong.
Okay.
You need to make sure that you get that child to see a specialist.
Thank you, Dr. Ibekwe.
so
Dr.
much.
Darlington,
Thank you.
parting words.
Yeah, attentiveness from the parents. The importance cannot be overemphasized because these children are vulnerable. They cannot speak out how they feel. In most cases, it takes a very attentive parent to identify that this child is not likely hearing. Let me take this child to ENT surgeon. In fact, it might interest you that 99% of people that you see are dumb. There's nothing wrong with their mouth. No. There's nothing wrong with their tongue. There's nothing wrong with their vocal cord. Yeah. It's just that the parents could not identify that these children we are not hearing until they grow up. Okay. Because it's only a child that can hear. That's only the child that can speak.
Okay.
And so that's why you see these two mobilities coming hand in hand, deaf and dumb.
Wow.
Deaf and dumb.
Yes, very true.
So most times nothing is wrong with this their speech. Tongue. Nothing is wrong with their speech pathway. It's just that they didn't identify the hearing loss early enough. So that shows you how important it is for us to do this campaign that hearing care is a right for every child.
Okay.
So early screening is very important. For the toddlers, they should have yearly hearing screening. Okay. Just like people exposed to loud sounds and people with comorbid conditions like hypertension and diabetes.
Okay, thank you very much, Dr. Ibekwe Nnemeka.
Thank you.
Consultant, ear, nose and throat, head and neck. Should I add leg?
Anyone you want to add it there.
Secretary, Nigerian Medical Association, Imo State, and head of the department, ENT, HN Federal Teaching Hospital. Thank you for coming, Dr. Ibekwe.
Thank you, Slim Diva.
Okay, Dr. Nwankwo Darlington Chigozirim, consultant and ENT head and neck surgeon. Thank you as well for also coming.
Thank you. It's my
All
pleasure.
right, we are going done. Final words, quickly.
I don't have.
You don't have? All right, my final words this morning will be that we should be attentive, like Dr. Darlington said, and Dr. Ibekwe also made a lot of points. Please, you have heard from the experts. We had to bring them so that they will help us sensitize everyone. I'm mostly particular about the youths, the teenagers, the trend these days. You don't have to jump on every trend. Please avoid earpiece, avoid AirPods. Those things will damage your ear canal. I cannot overemphasize this. I have said it a lot of times, and thank God the doctors have also repeated it this morning. Please let us do the right thing. Care for your eardrums as you care for your body. Yes. Very, very simple. My name is Mary Omeniwo. They call me the Slim Diva. You're most adorable. Bye-bye. Go ahead.
Okay, and I'm Judge Dawn Ikoma.
Okay, it will come your way again tomorrow. Thank you so much. J-Boy is also here. We'll bring you the news in few seconds. Don't go anywhere.
It's the sound of the